At Trinity Mother Frances-Jacksonville, we're committed to providing quality care for our patients. We know the healing process is just beginning as you return home from a hospital stay. That's why our pharmacist visits patients prior to their discharge.
A lot of times people get home and they sit down, they look at the medications that have been given. Most of them are new and they don't know what it is. At that point they realize either it wasn't explained well enough or it was explained, but they just were kind of out of it being sick, and so they need some help. That's where I come in. The goal is for me to go in as the pharmacist before the patient ever leaves the hospital, go over the list of meds, whether that's meds they've been on forever but maybe have some questions about, or also the new medications that the doctors are giving them once they go home from the hospital. We go over the medications, how they take it, how long they'll take it, and any side effects that they'd want to look for, and then how bad those side effects are, if it's something they need to get back in touch with their primary physician about or not. I think now people are realizing that healthcare doesn't stop once the patient leaves the door. It's an ongoing process. So we just want to do the best we can while the patient is here to make sure they have the knowledge that they need and not just hope that someone else gives them that knowledge.
It's that knowledge that the hospital wants to make sure their patients are aware of when they leave their care.
They say knowledge is power, so we're just trying to empower the patients on their journey to being well. Most patients, as you know, when they leave the hospital, they may not be 100%, 50, 60, 70%, but they're not completely well from a normal standpoint. So this just gives them the power, the knowledge to know how to deal with these issues themselves, to know what to look for as far as their medication therapy is concerned.
The hospital also knows that many patients rely on family, friends, or caretakers for their healthcare needs. That's why they're encouraged to participate in the discussion and address any questions they may have.
Now, of course, there are laws that state you can't just shout out patient health info to anybody, so you have to have the patient's permission first to talk to other family members or friends who may be in the room. Once that's established, especially if you're a caretaker, if you're going to go see mom every day and help with her medications, anything else that she has going on, then absolutely you need to be involved in the process, know what to look for, side effects, know what the medication's supposed to do, to know that your mom's getting better. You want to know what those signs and symptoms are.
Trinity Mother Frances-Jacksonville feels providing this discharge counseling service is just one small way they can help improve the overall health of their patients.
So far, I think it's working pretty well. It's a fairly new thing, but we feel like in the future that will pan out, that there will be a decrease in readmissions and an overall increase in patient health.